Daniella Westbrook revealed that she was left screaming during an operation on her face, that no anesthetic was used, that the surgeon slapped her, and that she hates the final result. Wow, what a headline, and we're going to dive into this. What exactly is going on here? My name's Dr. Julian De Silva. I'm a board-certified facial, cosmetic and plastic surgeon, and I specialize in London on Harley Street, and I specialize in only facial procedures and have done so for over 10 years. So we're going to have a look at this article, which sounds like a disaster. However, it does bring up quite important issues. Going abroad for cheaper surgery, bad outcomes after surgery, and bad experience after cosmetic or plastic surgery. Well, she revealed that she was left screaming and in agony during a terrifying operation on her face by a doctor in Turkey. The former EastEnders star had facial reconstructive surgery really in a bid to save her collapsing face. And she's admitted that she hates the results. Now, she told the Sun newspaper that the operation was incredibly painful and that she'd waited for this for years, and it was performed without anesthesia. Her phone was confiscated by an assistant as she begged him to stop. Now, she described a lot of crying, a lot of pain, and being really frightened. And without question, this sounds terrible, and we don't know for sure exactly what happened, but this is what has been reported in the news. It does raise some really significant questions, like hospital tourism. Now, this is defined by going abroad to save money for surgery. Now, bad experiences after surgery, what does that mean? And what about bad outcomes? How does that compare with normal outcomes after cosmetic surgery? The only real advantage of going overseas is really a saving in costs. Now, sometimes people think, well, it might be sunny, you may have a holiday, enjoy the sun. Well, the answer is really no, because when you're recovering from an operation or a procedure, well, you really need to stay out of the sun. That's so important for normal healing. What about the language barrier and the communication issues? Because how many staff are actually going to talk in fluent English in your native tongue? So how well can you understand your doctor, your surgeon, the nursing staff looking after you, the other support staff? Now, without question, communication will be limited, and particularly with facial surgery, a really clear discussion and understanding about expectations from surgery is so important, as every patient is different, and this could be quite limited in medical tourism. You really have to be on the same page when it comes to facial surgery, so you can understand, firstly, what's being done, secondly, how it's being done, and thirdly, what the expectations are for improvement. And what about anesthesia? Well, discussion regarding this could also be limited. She told the newspapers that her operation was very painful and it was performed without anesthetic. Now, that is really quite unusual, and it's quite difficult to think of a facial procedure that would be completed with absolutely no anesthetic. Options generally are either topical anesthetic, and that means putting a cream on the surface of the skin, local anesthetic, and that's what you have when you go to the dentist. And then there are more advanced forms of anesthetic, including sedation or twilight anesthesia, or even general anesthetic. Key with any kind of procedure is discussing about your medical history and your general health. And we know that Daniella Westbrook has had a colourful history that includes cocaine misuse, and this has caused some considerable damage to her nose. And it is possible that the doctors had less knowledge of this specific medical information, and maybe they didn't have access or knowledge to her past history. Now, recreational drug use, well, if it's done to a certain level, it can affect every part of the surgery. It can affect the anesthetic, it can affect healing, it can affect the final result. And of course, all of these aspects need to be discussed before having any kind of treatment. Now, despite undergoing another procedure in Turkey, Daniella has admitted she hates her face, and she's reported to have a procedure including facelifting, liposuction to her cheeks, lips, fat transfer to areas of her chin and jawline. Now, she said on Instagram that a photo of herself taken before the surgery, well, she actually can't believe what was done for her. And she wrote, well, 3 months ago, I looked like this and I thought I looked awful. I'd actually give the world to look like this again. Now, absolutely, this is a very regrettable situation. And potential risks and downsides. Well, some people have had absolute disasters in terms of medical tourism, disfiguring complications, and sometimes they've needed other revision surgery. I certainly have had patients come to see me who've been to Turkey and other countries who have not achieved the results they were looking for. Some, certainly those who have been reported in the news, and I did do a video on this, have had absolutely tragic complications. Although uncommon and rare, these things absolutely have happened. Why? Well, often there's less regulation, there's less care about safety and guidelines. And in the UK, well, we have a very stringent regulation that really protects our patients and gives them the best outcomes because of the level of detail that it has. For example, just in terms of the CQC, well, in a medical practice in the UK, no sink can have an overflow. And that might seem like a very fine detailed point, but multiply that out across the whole of how things are set up in the UK, it gives a very stringent system for patient safety. What about bad outcomes? Well, what are bad outcomes? It's an outcome really where expectations haven't been reached. And there's some important considerations with this because no two surgeons are the same. Some specialize in the face, some specialize more in the body, some in breast surgery. So different surgeons differ in their level of specialism and expertise. No two techniques are the same. For example, a facelift can be done in an hour, and that can just really look at tightening the skin, or a very conservative procedure, or a more detailed, deep plane facelift that's going to restore more aging to where it started. Well, that's going to be a procedure that takes a number of hours. And so the two techniques are vastly different, and the results are going to be very different as well. What about anesthetic? Well, there are different forms of anesthetic. The local, general, sedation, all of these need to be discussed before the day of the surgery so you have a really good understanding of what's in store. Complications. The reality, there is no procedure that has zero risks. Even some of the small, simple techniques, well, rarely you can have allergies, injections of non-surgical substance into the blood and circulation that can cause quite hazardous results. Although those things can be rare, those risks can never be zero. And then what about expectations? Well, key is really good communication with the patient. And emotion, there is definitely an element of emotion in terms of recovery and healing, and it's important to discuss these things before having surgery. And it certainly sounds like Daniella Westbrook, well, she wasn't properly prepared for this procedure. And swelling, well, it can look quite scary initially. Depending on what surgery is completed, you could look in the mirror and think, oh my goodness, it's so swollen, I didn't expect this. So even discussing it with my patients, a proportion of patients can still feel it quite an emotional experience. Now, most swelling goes down in a period of weeks. 80% goes somewhere between 2 and 6 weeks, depending on exactly what procedure was completed. And of course, there are things that can be used to enhance healing and enhance recovery. Now, surgery should not be underestimated. And definitely there is a trend, particularly with social media, positive expectations. There's sometimes a feeling that surgery can be a quick fix. And it isn't. There is a recovery, and communication and understanding of that recovery is so important. There's not one single thing that you can do that will give you a fast recovery. There are lots of little things. Sometimes using ice and cold compress. We have a sophisticated machine that can help with that in the first 24 hours. Specific medicine, anti-inflammatory medicines, well, that can really help reduce swelling. And then of course there are other things like oxygen, regenerative medicine, lymphatic drainage. All of these can have a role. Now, healing is a journey, and it's so important that you truly trust your surgeon in the healing process. And key to trust is a really good communication and rapport. Now, we don't know the exact circumstances with Daniella. We do know that it's really sad to read and hear about such an experience where the anesthetic the recovery and the result have really been unsatisfactory. Now, there are issues and risks going overseas for cheaper surgery, and I hope this has been interesting for you. Thank you for watching.